Got some breaking news this morning out of the CDC, the Centers for Disease Control. As CBS News learns that the mass firings ordered by President Trump at agencies across the federal government have now reached the CDC. And we're hearing this is not just reserved to new hires. So let's bring in Dr. Celine Gounder. She's a CBS News medical contributor and the editor-at-large for public health at KFF Health News. She was also a member of the COVID-19 advisory board of former President Joe Biden's transition team. Celine, I've been checking your email. You and I have been texting. Break down these changes that are already coming to HHS and now the CDC. What are you learning?
Yeah, what I am hearing is that of the about 3,000 new hires, so they are called probationary employees, but that really just means that they've been hired in the last year or so. Of those almost 3,000, over 1,200 are expected to be fired, some of them with about a month of administrative leave. But that's a huge proportion of the CDC workforce. People think government is big. Those are actually very big numbers proportionate to what we're talking about. And another group that is being targeted here are senior scientists, what we call Title 42 employees. These are some of the top talent. And then also the very youngest, the pipeline of new talent. And so this is very concerning when you have your top talent, your new talent being fired in one big purge.
So what is the impact to the American people? In other words, we're still in the middle of flu season. You've been on our air reporting about the spike in flu cases that we've seen across the country. We've talked about the rise in measles of young children in particular counties in the state of Texas. What does this mean when you don't have these scientists and these doctors and these medical professionals working at the CDC? What does it mean? What's the direct impact to individuals?
Well, I think we're going to see a couple things. One, it's a chilling of the public health service. So people will be afraid to do the work that they need to do in terms of informing the public, in terms of warning the public. We've also seen in some states like Louisiana pulling back on mass vaccinations. I think we'll continue to see moves like that. And that policy may not be guided by science, but rather by politics and ideology.
So one of the things that Robert F. Kennedy Jr. was fond of saying as he lobbied for this role, which he's now been confirmed, is make America healthy again. He's talked about changing the way that we eat, changing the chemicals and the additives that go into our foods. I do recall, though, that former First Lady Michelle Obama attempted to do something similar when she was First Lady of the United States. It's one of the projects that First Ladies typically undertake. And the howls of consternation from people, how dare you take away my hydrogenated fats and oils? It was loud and raucous, and now it seems like it's okay. So what do you take from what he means when he says make America healthy again?
Well, the problem is, what are his levers? No one is asking, how are you going to do this? I mean, we need to hold him accountable for the how. It's great to say we want our children to be healthy. What are the number one and number two causes of death among kids in this country? It's gun violence and it's motor vehicle accidents. There's nothing about that in the MAHA executive order that was signed by President Trump. What can he do in terms of food? That really comes down to a combination of the USDA and the EPA. HHS does not have a ton of levers in terms of improving and making the food supply more healthy. One very concrete thing he could help move forward on is a preliminary guidance at the FDA on front of package food labeling, essentially salt, sugar, fat, low, medium, high. And that makes it very clear to consumers, would make it very clear to consumers whether something's healthy. But whether that rule will be finalized under this administration remains very unclear.
Yeah, Celine, it's interesting, too. Now that I'm thinking back to it, Michelle Obama, she was urging Americans to do this individually. In other words, buy fresh vegetables and fruits for your family. The notion of removing the way our food is processed in this country, is that the purview of the Health and Human Services Secretary? I can see like, you know, the companies that control the kinds of chemicals and the kinds of hormones that go into the food that we consume having very, very large lobbies in Washington, D.C. and being against any kind of change to the way the food is processed here in this country. It's not like in Europe, where the European Union collectively decided to implement these changes, which is why you don't see as many obese people in Europe, as you know. But that would not be under his purview, would it?
That's exactly right. This is not under his purview. And in fact, during the Senate confirmation hearings, one of the senators kind of took him to task on this and essentially told him, you're going to need to stay in your lane, and acknowledge that this is not under your purview, that some of these issues are under the purview of USDA and also, for that matter, EPA when it comes to toxic chemicals in the environment. And so whether he can deliver on his promises, I'm very skeptical.
All right, Dr. Celine Gounder, always great to have you on this breaking news for us. It was really great that you were able to come on the air for us. We appreciate it.